Fall sports, they are in full swing, and we know concerns about concussions and head injuries in kids and teens, they really come sharper into focus.
So you got your bumps and bruises, they're all part of being a kid, right? But concussions can have serious consequences, even among those who are otherwise deemed healthy. To join us to talk about concussions is Dr. Meysam Kebriaei, the medical director of the neurosurgery program over at Children's Minnesota. So we have exactly the right person we need to talk to about this. Concussions, we look at concussions a whole lot differently now than we did when we were kids.
Absolutely. Like we were talking backstage, back in the day, back in my days, it seems like they kind of checked you out briefly and it set up some dirt on it to get back on the field. But now we know that you really need a step-by-step approach to recovery that includes physical therapy and brain rest so that you can fully recover and get back.
Can you explain exactly what a concussion does to a person's brain, more specifically a child's brain? What is it doing?
A concussion is basically a form of mild traumatic brain injury. So your brain sits in the skull in here like a bowl, and it's cushioned by spinal fluid, which is like water. So when you have a head injury or a brain injury, your brain, what happens is knocks into the skull and also gets stretched out. So those things can disrupt the brain and the pathways and cause a concussion.
Unfortunately, doctor, my son had a pretty bad concussion from hockey last year, and I was shocked at the recovery now that kids go through. I mean, he was going through physical therapy for this concussion. Can you explain to parents what they need to do if they're concerned their child has a concussion?
Absolutely, and just like you did with your child, I would really recommend patients get involved and have their kid enroll in a concussion program. So at Children's Minnesota, with a traumatic brain injury and concussion program, we really tailor recovery to each kid and what their mechanism of injury is and what their needs are. So physical therapy is a big part of it. Brain rest is another big part. You want to rest the brain, you want to stay hydrated. Physical therapy, vision therapy as well if they need that, so that they can go back to their life, their sports, and get back into things.
This maybe isn't a fair question because every child and every person is going to be different, but typically, how long does it take for a person to recover after a concussion?
Well, the good news is that most kids after a concussion recover fully by about a month.
Okay. A month's time.
A month's time. But then, doctor, what happens if you're in a sport, a football, a soccer, a hockey, where you get a concussion and then another concussion and then another concussion?
And that's why it's really important that you're fully recovered and cleared by a medical doctor or provider before you go back into sports, because it really sets you up for more concussions. So once you've had 2 or 3, you really want to think about maybe, especially after 3 concussions, being done with that sport.
I'm thinking about technology and how technology has evolved so much when it comes to preventing concussions. We've seen helmets that have changed and whatnot. The NFL, of course, has tried to tackle this issue head on. Do you think that technology is advancing enough to the point that it's actually helping to prevent concussions, or are there other things that, for example, that we can be doing, families can be doing to prevent some of these things from happening?
I think technology for sure, but just awareness. I mean, even 10 years ago, we weren't really admitting that concussions were happening as often as they were and putting kids right back into the sports. So I like that we're having more awareness for patients out there, for parents and kids out there, of what to look for and for coaches on the sideline.
Right. I mean, that's key, is coaches out there too, but coaches, parents, just always go in and get it checked. Doctor, thank you so much. We really appreciate it.
Thanks for having me.